You're listening to Civic from the San Francisco Public Press. On this edition, we'll take you along on an outreach shift in the Tenderloin, where community groups are trying to get people vaccinated.
Everyone has a why, so it's like finding out that why. And I'll tell you, we've been able to get a lot more people vaccinated just by asking why. Now, sometimes people get a little irate. They're a little pissed off because you want to ask them why. But when you tell them, like, hey, I'm just out here because I care, then they get it. You know, but and it's also nice to let people express themselves and how they feel about it, because it's important. Everyone needs to vocalize it. You know, sometimes when you say something out loud and you say like, hey, I don't believe in it because of this or that, and then you hear it out loud and then someone can say, oh yeah, I heard about that, I understand that, you know, and it just opens the door.
I'm Laura Wennes, and this is Civic.
You good? Have you been COVID vaccinated? We have it here if you want it. You're welcome. My name's Donna, by the way. I don't think I've ever seen you before. Nice to see you. I'll get to know you.
Donna Hilliard is walking the Tenderloin, offering everyone she runs into a COVID vaccine. She's the executive director of Code Tenderloin, an organization that offers a huge variety of services and classes, but during the pandemic, it's shifted into high gear trying to spread the word about COVID safety.
When we first started handing out masks in this community, nobody wanted them. And we had to really say, like, look, this is how it spreads. We put videos on the street. We did role plays. It sounds crazy, but we're literally like, if I spit, if I talk, this is where it's going to go, right? And so people started to understand. And then it went from no one wanting masks to people coming to us asking for masks. And so that was huge. So we went from like trying our hardest to get rid of like maybe 300 masks in a day to like 5,000 masks in a day. Like literally, we had a team of 42. We walked every single block in the Tenderloin every single day and handed out masks. And then, you know, we would go down in the alleys where no one would go. And that's where you would find people would be like, oh, we thought that was a rumor. We thought COVID wasn't real. We thought that was a rumor that someone that was high was spreading around, right? And so it's like, no, this is real. And so what we had to do was we had to start showing them videos and like, this is real, look at this. This, you know, I know such and such. Do you know such and such that lived in the tent a couple rows down? Guess what? I just seen them. They're positive. Like giving them real stories so they would understand that it was real. But honestly, they were thinking that it was just a rumor. You know, it's like, oh, it's some conspiracy rumor that's going around, right?
Now it's about getting people vaccinated. Most San Francisco residents are vaccinated now, but cases are rising. And as the highly contagious Delta variant spreads, there's concern in particular about people who aren't vaccinated. So groups like Code Tenderloin are trying to make it as easy and appealing as possible to get the shot. San Francisco doesn't track vaccinations specifically by housing status, so it's hard to say how many of the city's homeless have or haven't been vaccinated. And among people who haven't, it would be impossible to give one clear reason.
So many of the community members are telling us, like, what's the use in getting vaccinated because people are still getting COVID. And what they don't realize is that is the variant. And the huge thing is, if you're not vaccinated, you're more likely to be hospitalized with COVID. And we're even seeing deaths. So what we're trying to educate them is that, no, it's not 100% make it where you don't get COVID, but it's less chance of you being hospitalized and dying. And I think, you know, it's hard to, when there's so much media around the variant and, you know, there's already so much around don't get vaccinated, it's hard to really talk to the community about it because they're seeing the positives. So, but also a big part of it is they're really scared.
Of what?
They're scared of the unknown, and they're scared of what they're hearing. So a lot of our community, right, they've all been trying to survive, and their best way to survive is like get up and move and hustle, right? And so when they see something coming, they just automatically, it's like, I gotta move, I gotta go, no, here they come, no, like, and so just trying to let them understand that we're trying to help, and we're trying to help them be as safe as possible.
Do you ever get people asking you if you've gotten vaccinated?
All the time, and I say yes. I actually, you know, for myself, it was hard for me to even cross that line because of the history. You know, as being a woman of color, like there's so much history with Tuskegee, like, you know, just being a woman in general, there's different trials and different things they've done to our bodies. And then also when Johnson & Johnson had that big thing, like That was like huge. Like we had women that were like, don't come near me with that. Like literally like, I don't want to see it. No, no, no. But then as we keep doing this work and the more people I see sick, like we literally had people that were living in tents who were testing positive. We made sure they could stay in their tent because that was their home, and we were taking food to them, right? Some people were okay, but some people were really sick. And when you see that with your own eyes, you're gonna get vaccinated. You know, it's just like, okay, I gotta do what I gotta do. But also like for me and my team, we all knew we needed to continue this work because so many things had shut down here in the Tenderloin that you could see it. You walk the streets and you just know, like, whatever we could do. We were making peanut butter and jelly sandwiches. We didn't have a lot of money, so we're like, we gotta feed people. We gotta like, you know, whatever it is. So, yeah. So I tell like all of our ambassadors, tell your story and be authentic, right? It's not about the marketing and the flyers that are put out there. It's about being real and authentic to the person you're talking to because they know that. They know like, okay, yeah, such and such got vaccinated. This is why. Oh, maybe I should think about it. And don't just be like, you want to get vaccinated and they say no and that's it. It's like, why? Ask why. Everyone has a why. So it's like finding out that why. And I'll tell you, we've been able to get a lot more people vaccinated just by asking why. Now, sometimes people get a little irate. They're a little pissed off because you want to ask them why. But when you tell them like, hey, I'm just out here because I care, then they get it. You know, but and it's also nice to let people express themselves and how they feel about it because it's important. Everyone needs to vocalize it. You know, sometimes when you say something out loud and you say like, hey, I don't believe in it because of this or that, and then you hear it out loud and then someone can say, oh yeah, I heard about that, I understand that, you know, and it just opens the door. So that's really like, you know, the key piece of what we're doing with the doctors and the nurses when we're walking around is we're like that liaison. Like we can speak the language of the street and people actually feel more comfortable asking us a question. You know what I'm saying? And we're not talking medical terms, so they get it.
Whatever a person's situation might be, chances are good that a Code Tenderloin staff member has been there.
As the world tries to define the approach on how to talk to homeless people and cool people and the forgotten people and all that, we are that person. That defines Code Tenderloin. We the homeless person, we the mental illness, we represent prison background, we represent alcoholism, all that stuff, you know, anything that made up the community, we talk that language and it's okay for us to, it's okay for me. I ask anybody, no matter what state of being, can I help you get you vaccinated?
That's Elgin Rose, Senior Program Manager at Code Tenderloin.
Most of the time people don't really realize the value in it or it's other stuff going on. So why would I get vaccine today? I haven't even eaten today. So, and why is that a priority again? Who are you again? So
well, what do you tell them when they say, why should I get vaccinated? Or if they say, nah, no thanks, I'm good, actually.
Why is that?
If they say like, no,
I'd ask them why. I ask them, I've been vaccinated. I'd want to hear more about it. I'm starting to talk about the history of vaccines and how vaccines have been effective. And I get people always bring up the what's the old story or you know, it's a lot of the history where they did some vaccines, you know, and the black folks was, you know. Anyway, it's a lot of historical negativity around experimentation and just complying to the system in general that don't really care about me other than today. Now you want me vaccine, but you didn't say that when I was homeless. You didn't say when I was, you know, when I broke down last night or I had to steal to eat and all those things. So it's just really just being clear-eyed, and we get that they looking like that. So me, I'm like, I feel the same way. I don't even know why I got vaccinated. I mean, I know why, because I got kids and I got a community, and I represent, you know, so don't want to be a hypocrite. So, you know, I you know, but that doesn't mean I'm overeducated about vaccines as much as I've been doing work. So I understand where they're coming from, and I just want to let them know that they have access, because access is bigger than just saying I'm in your face. Access is also the education and, you know, and timing and all that.
Mm-hmm. So how come you do outreach for the vaccine if you were a little bit not so sure why you would get it yourself? Sounds like ultimately you found the reason.
Well, I know more people died without the vaccine. It doesn't take me, I have to be a scientist to know that so many people died. And with that being said, there is the risk-reward factor. It's clearly outlays it, even if you didn't teach me no more today, Although I have questions, so I understand that they have questions and need to be able to make them informed as they can.
Yeah, that makes sense. What's the most common thing that people say when you approach them about getting vaccinated?
Either I've been vaccinated is the most common one, So then, that's the most common. That's But then, obviously that's the easy deflection word too. So you gotta say, where'd you get vaccinated? I'd love to, if you don't mind me asking where. So, just for a giggle, right? And so that de-arms them again. And a lot of times they were just brushing you off, But most people seem to be vaccinated, or the hard nose or hell no, you're not putting that in my arm. And I remove the explicatives from that statement.
Right.
We'll hear more about that in just a moment when we return to this story about vaccine outreach efforts in the Tenderloin. You've been listening to Civic from the San Francisco Public Press.
KSFP and the San Francisco Public Press are supported by listeners like you. Learn more about our membership program and join the public press at sfpublicpress.org/donate. Thank you, and thanks to the thousands of donors who have made our work possible for more than 10 years.
Let's go back to the Tenderloin and follow along with some outreach workers who are bringing COVID vaccines straight to the streets to remove barriers to access. The outreach and healthcare workers start out at Glide, a nonprofit in the Tenderloin that provides services ranging from free meals to legal services to childcare. Glide has set up a sort of staging site for the vaccine effort. This is where I met Cheryl Henry, who goes by Candy, who told me about her experience getting vaccinated.
Myself, I didn't want to take it because I'm hearing stories, but then I'm not a follower. I'm not a leader either, but I could be, but I'm definitely not a follower of negative. And so I took it anyway, June the 5th, and I'm just coming to get me a new car because, I'm sure everybody, take it to the stores, and it's just getting raggedy. So I'm asking for a new one, right? So, and the thing is, I think people should show their cards now going in places before they go in places. That's what I feel. Because how you know if they really got one, without the mask now. And then I'm feeling like I really want to take this mask off since I have this, so what do you think? I mean, thank you, love. I have ideas if you want to see. That's me. Cheryl Henry. And I appreciate, it was at Bodeca Park, June 5th. I don't like needles. I'm not allergic to, but my phobia are mice, needles, and airplanes, and mice first. But then needles, so it took me a minute. I didn't want to take it like I said, right? Yeah. So they talked me through it. So and did give me a shot at the same time they was talking to me, so they did good. They did.
Distract you.
Yes, they did. They distracted me, but I did take it, and I think I did good. I did right, the right thing. You know what I mean? Yeah. So I encourage everybody else to take it too. That don't. Maybe we should walk around and just stop poking people.
From Glide, two groups head out into the streets. Each has outreach workers as well as people who will administer the vaccines or take down vaccine recipients' information. They have a little rolling crate with them with a few items to distribute, including masks. And of course, a box containing 5 doses of vaccine.
So basically, once they're open, we have about 20-30 minutes to get rid of. So what we do is we have about 5. We keep 5 doses. When we're getting ready to be on our last dose, we have a runner. One of the Code Tenderloin folks runs back and gets another 5 doses. Sometimes on some days we know it's going to be a little thicker out here. We'll actually start with a couple extra doses. But most of the time we start with 5 just so that we don't waste anything. And then at the end of this, you'll see if there's anything left. Say we got 5 and it's like, 3 minutes before we're supposed to stop, we'll just keep working. Yeah. So we get rid of those. Yeah.
part of the work is just knowing the neighborhood and knowing what to expect on different blocks depending on what substance people are using there.
So what a lot of people don't realize is you have to approach everyone that's on a different drug a different way. Yeah, because some people are paranoid, some people are like really low, and you gotta like speak up and clear and fast. Or if you're gonna give them the vaccination, like we've had to educate the doctors, like when there's people who are fiending for their next fix, they want to get vaccinated, but you got to do it fast because they're going to get dope sick and then they want to go. And so we've helped them create a way to do the register. So like they go through the allergies first, or they go through this first. Like she's saying she doesn't want to wait. Like, so we've really been educating them on like you have to know what it is, what they're doing right now. You know what I mean? And it's been very effective.
On this shift, there were plenty of people pretty quickly who were interested in getting vaccinated. But there were also plenty who just ignored the announcement that there were vaccines available or who didn't want it at all. Brian Lopez asked in English and Spanish if anyone wanted their shots.
Hey, you want to get vaccinated? Anyone want to get the vaccine shot? Anyone want to get the vaccine shot? Anyone want to get the vaccine shot? Oh, no. No? Oh, no.
There was some mistrust, too.
Y'all working for the government, that's what y'all doing. Y'all promoting death, injecting people with y'all know nothing about.
And there were also people like Tyrone Dotson, who had been wanting to get a shot for a long time, but it never worked out.
So what was that like for you? You just got the vaccine. Congratulations.
Thank you, ma'am. I'm so happy because I was wondering when I was going to go down there and get it. Because of the hospital, they full. The medical doctors around here, they full. So I didn't know what I was going to do, you know.
It's all right.
And I was booked, so, you know, waiting in line, waiting for them to call me. They ain't called me yet, so.
So it made more sense to just do it when someone comes up and offers it.
Yes, ma'am. Yeah, that was a great opportunity for me, so I'm happy for me.
How long have you been wanting to get vaccinated?
Since it was available. Since then. You know, I've been waiting, praying, you know, because I don't want to be sick.
Right.
You know, that's the best thing out for me, though.
Yeah.
You know, and it's free, so, you know, I'm happy for myself.
Exactly.
Yes, ma'am.
So now are you going to tell the people about it?
Yes, ma'am, I will. And my family also, so.
Oh, good.
Yes, that Glide, right?
Yeah, they're associated with Glide.
Yeah, so I'm going to tell my family members, my friend members to just go to Glide in.
And Code Tenderloin, I think, is the group these guys are with.
Okay, thank you.
What was it like to get the actual shot? Did it hurt?
It's a pinch. It pinched me.
Okay.
You know, I'm scared of needles anyways.
No, but you did it anyway.
Yes, I have.
When you talk to other people about it, are they worried about getting it? Like other people out here?
Pretty much. You know, we all still scared. We don't know what's going to happen. You know, either one of us, we can get sick anytime. So, yes.
Do you spend most of your time out here?
Pretty much, yes. Yes.
So would it be like is it a factor to have to get transportation out to wherever you would get it if you had to go to an appointment?
Yes, ma'am. Yes.
Yeah.
Yes.
I should be clear that this outreach isn't necessarily only for people who are homeless, and I didn't specifically ask for people's housing status. There are tons of people out in the neighborhood who might want a vaccine but haven't gotten it for whatever reason, and that includes people who earn a living here.
The other big thing we do is we try to go into all the store owners because a lot of them can't leave, right? They're small business owners and they can't leave their store and shut their store down because they're struggling right now. So we've been able to go into stores like some of these liquor stores, smoke shops, restaurants, and go in and bring the vaccination to them. And they're like so grateful and so happy because they really want it. They just couldn't leave their store to go get it. So like this guy got vaccinated, but sometimes we'll go in and we'll ask the person that's at the front, and then they'll bring out 4 or 5 family members, right? And we're like, oh, great.
Everyone gets a vaccine.
Yes. So, I mean, there's definitely a need for us to bring the vaccine to people. And, you know, I think people don't talk enough about that. They're just talking about, you know, we have all these people who are not vaccinated, but it's like, there's a lot of people out there, but you got to take it to them. Like literally. Yeah. Like I can't tell you how many people we find like, oh, I really wanted to get it done. I just, you know, life, right?
I had to work.
Yeah, like
I had to be wherever, yeah.
I'll tell you, we were on Turk and something, and there was a construction zone. And so we're just like, hey, has everyone been vaccinated? Like, might as well ask. We had 2 workers come off of their work trucks and come down and get vaccinated. Like, are you kidding me, right? But these are people who are working so hard. A lot of them working 2-3 jobs.
Yeah.
You know, just to take care of their family. They don't have time to stop work. They can't take a day off to do it.
The outreach shift I tagged along with was in the late afternoon into the evening, when it had originally been planned for the morning. The idea is to be there to catch different groups of people as they go about their business.
So we've really been playing around with the times to do this mobile vaccination. We were doing the day. We just switched to the evenings because especially on our blocks here, like the dope dealer blocks, they work shifts. And then different people come out at different times. So we're hoping, this is the second week we've done it in the evening, that we'll be able to capture a whole nother crowd.
Yeah.
By the time the shift ended and the team returned to Glide, they had administered 23 vaccines in around 3 hours. They ended up with 5 left over. You might recall that in my last interview with Dr. Margot Cashel from UCSF, she estimated that the teams administer between 10 and 20 vaccines a shift. So 23 seems pretty good. A successful shift, yes, but for Donna and Elgin and Brian and the others working on this outreach, it's just a small portion of what's on their minds for this neighborhood. COVID isn't even their biggest concern. For Elgin, it's mental health.
Mental health kicks COVID, in the derriere.
Wow.
Yeah, because it's lasting. They want to wipe this away so it can be over, and then you still got people COVID free, but suffering like dramatically.
Yeah.
So that's big, and you don't and there's no textbook treatment on mental health. It's like you gotta undo all the stuff that people go through for years, or homelessness for 10, 20 years. People, that's a regular story down here.
10, 20 years?
Hell yeah. I mean, yeah, exactly. I'll take the 10, and then I'm sure somebody's well beyond 10. Once you give up and you accept this type of life, then you're okay with it. So that's what we see down here in the Tenderloin. People okay with it because there's no expectations.
For Donna, it's overdoses.
I would definitely say the fentanyl and the overdoses is definitely bigger than COVID right now. It just breaks my heart because, as you see when we're walking around, you see the blatant drug dealing. You see it. You know what I mean?
Yeah.
You know that this is killing people. You don't see anything being done. It drives me freaking crazy. Like, people don't even have to hide it. It's like, but there's so many overdoses. There's got to be something done about this. Look, when we walked those couple blocks, we saw people using fentanyl.
Yeah.
You see a couple people with Narcan, like our ambassadors had Narcan. You saw Ergomalchemy, they have Narcan. That tells you that the overdose rate is too high, that everybody around the community is walking around with Narcan. But why are we allowing it to just be so free on the street like that?
Both of these are huge, thorny issues that Code Tenderloin is grappling with and likely will be for some time. There's always more than enough to do, and things are particularly hectic now. Donna said she and Elgin have been working long hours with no vacations since the pandemic started. But she said it's worth it.
Every day when I think I'm burnt out, like, it was so funny, like, 3 days ago, I was like, I'm tired, dude. I was like, I'm tired. Like, we need to take a break, right? And so I let everyone leave early. And when we were walking out the door, one of the students came in. His name is Donovan. He's like, wait, I came here. He's Jamaican. He's like, I came in here to tell you, I started my business.
Nice.
And I want to say thank you. And I want to put Code Tenderloin logo on my work truck and like all this. So I was like, what? And we're getting ready to leave. And here he comes saying all these wonderful things. And I was like, oh my goodness. And he's like, and my gift to you, I want to hire a Code Tenderloin student to work in the business. I said,
wow.
What? Yeah. I was like, great. We have someone in the lobby right now that's just looking for work, right? So that was like amazing, right? Here I am burnt out. And here he comes in and says that. And then as he's getting ready to leave out the door, here comes another student. I was like, you got to be kidding me. He's starting a bit. I said, no way. I said, this cannot really be happening, but that's how crazy it is, right? Like, here I am the day. I'm like, you guys, we're all going home. We're burnt. And here are these great people coming in with these great stories. And there I am just energized right back up again, like craziness.
There's no escape, but in a good way.
Yeah, exactly. Yeah.
That was Donna Hilliard, Executive Director of Code Tenderloin. I'm Laura Wennis, and you've been listening to Civic. Before I let you go today, At the Public Press, which is Civic's parent organization, we've been working really hard during this pandemic to pursue angles we're not seeing much coverage of elsewhere, or to take a more systemic look at the issues that are surfacing in the headlines. The San Francisco Public Press is a nonprofit, and we're inspired by the public radio model. That's the idea that people who are able to support the work that we do so everyone can have access to it without paywalls or ads. If you think we're onto something, we'd very much appreciate if you could show your support. You can do that by going to sfpublicpress.org/donate, or by helping us get the word out about this show. Subscribe on whichever podcast platform you use, or leave us a review. It really does help, so thank you.